Assalamu alaikum. Today we are going to talk about human immunodeficiency virus, or called as HIV. HIV is a virus that attacks the human immune system. It has no cure. Once people get HIV, they have it for life. But with proper medical care, HIV can be controlled. HIV infection in humans came from a type of chimpanzee in Central Africa. The chimpanzee version of the virus that was probably passed to humans when humans hunted this chimpanzee for meat and came in contact with their infected blood. Study shows that HIV may have jumped from chimpanzee to humans as far back as the late 80s. Over decades, HIV slowly spread across Africa and later into other parts of the world. Stages of HIV. Stage 1. Acute HIV infection. People have a large amount of HIV in the blood. They are very contagious, have flu-like symptoms, but not everyone will experience this. Only antigen or antibody tests or nucleic acid tests can diagnose acute infection. Stage 2. Chronic HIV infection. People can often start to feel better. HIV is still active but reproduces at very low levels. HIV may not cause any other symptoms for up to 10 or even 50 years. People can transmit HIV in this phase. If left untreated, over time, HIV infection will cause serious damage to the immune system. Stage 3. Acquired immunodeficiency syndrome. AIDS. The most severe phase of HIV infection, people with AIDS have such a badly damaged immune system that they get an increasing number of severe illness called opportunistic infections. People with AIDS can have a high viral load and be very infectious. Symptoms can include weight loss, chronic diarrhea, persistent cold, mouth, and skin problems. Without treatment, people with AIDS typically survive about 3 years. How it happens. Infection happens when foreign invaders such as bacteria and viruses get into your body. When this happens, your body defenses will be activated. The white blood cells of your immune system are part of your body's defenses. One type of white blood cells, helper T cells, threaten your immune system response to infection in two ways. First, helper T cell release chemicals that attract other white blood cells to the site of the infection. These additional white blood cells attack the invading bacteria or virus, as well as other infected cells. Second, helper T cells release chemicals that cause other white blood cells to multiply. These new white blood cells create markers, which called antibodies, which can identify the same foreign invaders throughout your bodies. Antibody attach to the bacteria or virus, marking them as target for your immune system to destroy them. But if you have HIV, it travels through your blood and other blood fluid to infect and kill certain white blood cells. As helper T cell is its main target, the virus enter into the cell and make many copies of itself. As these virus particles are made, they leave the damaged helper T cells to infect other cells. The T cell loses its ability to protect the body from the ongoing infection and dies. In this way, HIV spreads and kills more of helper T cells, weakening the immune system. As a result, other types of infection are able to take advantage of your body's inability to defend itself. These infections are called opportunistic infection. How HIV is transmitted. The person-to-person spread of HIV is called HIV transmission. People can't get or transmit HIV only through specific activities such as through sex or injection drug use, and can be transmitted only in certain body fluids from a person who has HIV. HIV transmission is only possible if these fluids come in contact with a mucous membranes or damaged tissue or are directly injected into the bloodstream. Mucous membranes are found inside the rectum, the vagina, the opening of the penis, and the mouth, and you can't get HIV from casual contact with a person who has HIV, such as handshake or a close mouth kiss, neither from contact with objects such as toilet seats, nor dog knots used by a person who has HIV. How to prevent from getting HIV. Get tested for HIV. Talk to your partner about HIV testing and get tested before you have sex. Choose less risky sexual behavior. HIV is mainly spread by having anal or vaginal sex without a condom or without taking medicines to prevent or treat HIV. Limit your number of sexual partners. The more partners you have, the more likely you are to have a partner with a poorly controlled HIV or to have a partner with a sexually transmitted disease, STD. Both of these factors can increase the risk of HIV transmission. And then, lastly, don't inject illegal drugs. Treatment. The treatment for HIV is called antiretroviral therapy, ART. ART involves taking a combination of HIV medicines called a HIV treatment regimen every day. How do HIV medicines work? HIV attacks and destroys the infection-fighting CD4 cells of the immune system. It makes it hard for the body to fight off infection and certain HIV-related cancers. HIV medicine prevent HIV from multiplying, which reduce the amount of HIV in the body, called the viral load. It gives the immune system a chance to recover and produce more CD4 cells. By reducing the amount of HIV in the body, HIV medicine also reduces the risk of HIV transmission. Overall, the benefit of HIV medicine far outweigh the risk of side effects. As HIV treatment continues to improve, people are less likely to have side effects from their HIV medicine. That's all for me. Thank you.